One of the fastest ways to fail in an EMT scenario is missing inadequate breathing. A patient can be awake, talking, and even looking at you, and still be failing to ventilate. And if you don't recognize it early, everything else you do as an EMT starts falling apart. In this video, we're breaking down adequate versus inadequate breathing and what the NREMT wants you to recognize, and the biggest signs new EMT students miss. Let's get into it. Why airway matters. The first priority in patient care is always life threats. And one of the biggest life threats is a patient who cannot oxygenate or ventilate properly. Remember this, breathing and circulation work together. If oxygen can't get into the lungs or carbon dioxide can't get out, the body's tissues and organs begin to fail. That's why airway and breathing assessment happens early in the patient assessment. What is adequate breathing? So, what does adequate breathing actually look like? For an adult patient, normal breathing is generally 12 to 20 breaths per minute. But respiratory rate alone is not enough. A patient can breathe 16 times a minute and still be breathing inadequately. You need to assess chest rise, work of breathing, lung sounds, skin condition, and mental status. Signs of adequate breathing include regular breathing pattern, equal chest rise and fall, clear bilateral lung sounds, adequate tidal volume, and normal skin signs. The patient should not appear exhausted just from breathing. Biggest EMT student mistakes. One of the biggest EMT student mistakes is focusing only on respiratory rate. The NREMT wants you to recognize quality of breathing, not just speed. A patient breathing 24 times a minute with shallow respirations may be ventilating worse than a patient breathing 10 times a minute with good tidal volume. Watch the chest. Listen to the lungs. Look at the patient. Is air actually moving? That matters. Signs of inadequate breathing. Now let's talk about signs of inadequate breathing. This is where the EMT students must get comfortable recognizing respiratory distress early. Signs include respirations under 12 or over 20, shallow breathing, irregular breathing, diminished lung sounds, unequal chest rise, cyanosis, accessory muscle use, nasal flaring, and retractions. You must also see altered mental status, anxiety, confusion, or exhaustion. And here's a really important point. A patient using accessory muscles heavily may look like they're breathing hard, but they're actually beginning to fail. Agonal respirations. Now, let's talk about something the NREMT loves testing on, agonal respirations. Agonal respirations are not normal. These are occasional gasping breaths that can happen during cardiac arrest. If the patient has agonal respirations, you should treat them as not breathing adequately at all. That means airway management, ventilation support, and likely CPR depending on pulse status. Do not confuse agonal gasp with effective respirations. What EMTs should do. If the patient is breathing inadequately, you must intervene. That may include opening the airway, suctioning, placing an airway adjunct, administering oxygen, or assisting ventilations with a BVM. Remember, oxygen alone does not fix poor ventilation. If the patient is not moving air effectively, they need ventilation support. Recognizing inadequate breathing early is one of the most important EMT skills you'll ever learn. Not because it helps you pass the National Registry, but because airway problems kill patients fast. And the better you get at spotting respiratory failure early, the better EMT you will become. If this helped you understand airway assessment better, hit subscribe, because we're building an entire EMT airway series covering OPA versus NPA, suctioning, BVM ventilation, oxygen devices, CPAP, and airway emergencies. Trust me, these are the exact topics students struggle with most.